So this week on the Provider Spotlight, we do have a special guest with us, Chris Craig, the owner of Fitness Genome. I'm not going to talk too much about what Chris does. I'm going to let Chris kind of lead the conversation for us today. So Chris, thank you so much for joining us. If you could please introduce yourself, provide everyone some background about what you specialize in and how long you've been practicing for.
Yeah, it's sort of a biohacking lab, to use that term, but it's just all different sorts of injury, treatment, wellness, some degree of a little bit of aesthetics. So it's just a mix of all those different things. But we see a lot of different athletes that come in a lot of the time with injuries that maybe haven't had a lot of success treating as of yet, or maybe they have, and this is just a good adjunct for them. But yeah, that's pretty much what we do here.
Awesome. You mentioned biohacking. You guys are a biohacking lab essentially. And I do understand, I remember when we first spoke, you are mainly modality focused. You have an emphasis, you specialize in neurology, pain management, weight loss, and many other things. And I think it would be really cool for everyone to know, those watching, how you were introduced to StemWave and what was it about our technology that prompted you to integrate this in the first place, instead of maybe some of the other shockwave therapy options you were also exploring at the time?
Yeah, well, I think I had an injury in my left shoulder. I'd had a torn labrum in this left shoulder for years, and just wasn't seeming to get any better. And a friend of mine actually got the device and hold on, and basically treated me about 6 times with it. And I was just amazed how much better my shoulder got. I thought I was going to be headed for surgeries as a certainty, but yeah, and it's held up great ever since. I'm able to work out, lift heavy kettlebells overhead. I couldn't even lift my arm overhead for a while, and so it's held up and even better than a good shoulder for the past probably year. So that's what really got me interested in StemWave, and I had to get it for myself, and then I could see it being a great tool for everyone else that came in with injuries that mix with what we have here. Yeah.
You were actually one of the first few providers who actually joined us here at the company, with trying our device. So we're pretty much a year into this whole journey with you and your team. Talk to me a little bit about the success, some of the unexpected positive outcomes you noticed just in the last year from integrating this and in the recovery plans of some of the athletes you work with and some of the people you see.
Yeah, no, I think it usually exceeds people's expectations. They most of the time I hadn't thought about it, but you guys actually prompted me to do it this way with the introductory offer, and they can just do it the first time at a lower cost, and that'll often get them to try it. And usually after one treatment, they can feel a difference that somehow they've gotten better with it. And maybe they don't understand exactly how it did what it did, but they feel better, and then it prompts them to follow up with the treatment. I sort of tell them that we'll know when the road sort of reached the end, when the pain's pretty much managed and a lot of the functions back, depending on what it is. But it's been really great for anywhere from top athletes to just your average everyday Joe. Yeah.
We get a lot of patients also watching these segments, and a lot of them want to know a little bit more about how you would educate your patients and athletes about StemWave and its potential benefits, especially since shockwave therapy is not a very common modality within our industry. It's fairly new, in terms of it being introduced in the market. So how do you educate your patients and your athletes that you see, and more importantly, how do you communicate the option of StemWave treatments as like part of like their overall care plan?
Yeah, I think as I mentioned, just doing that introductory one with so many things, especially in a biohacking lab, you can explain what it does, how it works, but until they actually feel it, it's hard to explain. It's hard to convey exactly how they're going to feel after it or what it's going to feel like while we're doing it. But just getting them to try it and feel the result, I think, is the big key. But and a lot of people, I just tell them they want to know what it's doing, how it's doing it, but I don't get into a lot of great detail. I just sort of mention that it's gonna get their body to migrate stem cells, growth factors, that area where we use it, where we feel more pain. Maybe there's a tear in tissue or whatever the case may be. But that's enough for them to go forward with it at least the first time. And then once they start to feel the results, then they're ready just to complete the rest of the package until they do get to where they want to be. But that's generally how I just get people going with it. It's not anything that complicated or intricate. Just give it a try. This is basically how it works, and let's see how it goes.
Yeah, so just seeing the results for themselves, because you know you're gonna get that like
See you
positive
later.
feedback each
All right.
time. um, if it's okay with you, can you actually share with us like some specific cases, any like successful cases, notable cases where StemWave played a crucial role in the recovery and rehabilitation? And I guess like maybe outlining what that process was, like some information about that patient and that person you were treating and where they are today.
Yeah, I mean, I think there have been a lot of cases where just the mapping in the beginning sort of opens the patient's eyes as to maybe they didn't realize there was that much of a problem, say with the knee, for instance. You find a couple of spots that are really painful and there's a lot of feedback there. Then I think with any person, it just naturally creates the desire to want for that to get better, for that pain to lessen. And I'd counsel them that we can get them there. We can lessen that pain and improve the function. But that's generally how I start people off. Is just again, it just comes back to them doing it, feeling it, and then especially in the mapping process, they feel exactly where the issue is, and they really can connect more so with the treatment. I think once they feel it in terms of pain and feedback.
Yeah.
Yeah.
What kind of, from like a clinical perspective, what are some of like the unique advantages that StemWave offers compared to maybe some of the other modalities you've implemented in your facility in the past?
Yeah, I think it's such a strong intervention that it makes an impact. That's why that first trial is so key, is that when they feel it has that much of an effect from the first one, then they can sort of extrapolate in their minds as to how I can get so much better if I finish the treatment that he's recommending. But yeah, it just comes back again to them feeling it, and then we sort of get on a schedule of what's going to work for them budget wise, time wise. But or if they have a goal upcoming, they want to do a run or a fight or whatever it might be. But that's always helpful to have an end goal to map that out in the beginning too.
Yeah. What's kind of like, if you don't mind sharing, do you have like an example of like someone you were treating and kind of what some of their goals were and what prompted you at least to integrate StemWave within their recovery plan and towards them getting those opportunities and achieving those goals?
Yeah, no, I've had a lot of people that have had goals, such as there's a lady who she had a hip surgery, and then she wanted to run, I forget which marathon it was, but it was about it was pretty maybe 4 or 5 weeks out. And so felt like the stem wave was going to radically increase the recovery time and get her where we probably ordinarily would not have been able to run that race at that time, but that the stem wave ushered in a lot more healing a lot more quickly, and she was able to meet that goal. And I think it was the Boston Marathon. I'm thinking about it, but
That's
so for her, it was a lifelong dream. But
yeah.
yeah, yeah. But there have been a lot of those cases where if you can put that sort of end goal on it, but if not, but yeah, either way, I mean, people once they feel it, they're ready to complete it.
Yeah, it's
Yeah,
almost like the heavy lifting is done for you in terms of getting that commitment. And I think
yeah,
sometimes working with athletes, working in fitness and biohealth in general, that's sometimes hard, right?
Mhm.
Especially when there are modalities that people are not familiar with, like such as ours. So I
Yeah.
think that's super insightful for a lot of clinics, a lot of similar labs out there that are thinking about whether this is something that is going to be receptive to, their clients and like the patients that they see. So no,
Yeah.
thanks for saying that.
Yeah. No, it's definitely a unique and extremely useful device. Yeah.
Have you noticed just like over the last year, how has your practice evolved? More so, how have you guys molded the way you guys approach therapy with the integration of StemWave? Have you paired this with other modalities as well? Talk to me a little bit more about how you've kind of done that just all around within your facility.
Yeah. I think it's put a little more initial emphasis with someone's intake on based on do they have injuries to speak of? Have they had a long standing or new injury and do they want to the stem wave's a key part of addressing any injuries, and it mixes in well with a couple of other modalities we use. Maybe not just necessarily stacking them, but incorporating them with, say, the pulse center PMF, and then I use the ARP wave some. If we're looking for the root of any problem, the ARP wave can help identify where the body's protecting the most. So it just fits in well with other modalities that we have here, but it does put more of an emphasis on the initial intake, getting to the core issue of whether they've had injuries or if that's, but that just has been an additional sort of leg of our intake, the sort of wellness and there's injuries now here. Yeah.
What's kind of the difference? Let's say someone comes in for, well, let's look at two scenarios. Someone comes in with with a knee injury or lower back pain, right? What is kind of the intake process, and more so, what's kind of like the typical protocols that you would take with using stem wave and other modalities to contribute towards their treatment? What does that process kind of look like for maybe some of the patients that are also watching this and would maybe like to visit your clinic or like a similar sort of practice?
Yeah, no, I think it's just identifying they've had injuries. Oftentimes when they think about it, they have other injuries that they don't necessarily remember, but they come more to the fore when you begin to work on one injury and they think about something else that's contributed to the existing injury they have now. But yeah, with the stem wave, a lot of time we'll just break into it. And if it's appropriate, say, when you say you have a knee issue, let's just try the stem wave and let's map with the stem wave and just see the extent of the injury and maybe how much we can help it with the stem wave. And it's pretty it's immediate feedback, so to speak. So oftentimes that's a good way to get people integrated immediately is use the stem wave right up front.
Yeah.
Yeah.
And really the results explain themselves, right? Rather than you having to kind of go
True.
into some of
Exactly.
the
Yeah.
details.
Once they feel it and they can quantify it and relate to it on their own, it's yeah, that's the easy part from there on because they know the potential of the stem wave and they know the problem they have and it's been mapped out pretty succinctly so they know what they need to do and it doesn't take a lot of salesmanship at that point. You just
Convincing.
yeah, this would be a good course to take and if you want to take it, be a good idea. Yeah.
Mhm. So it pretty much sells itself. With
Yes.
that being said, outside of like the clinical success, you're a business owner yourself, and you do understand prior to making any sort of financial commitment with purchasing a modality such as ours, there's almost like a cost analysis and there's a lot of different things you'll need to consider, right, in terms of generating that revenue, and whether this is going to be receptive within your market and more importantly your client base. So outside of like the clinical success you've garnered with our tech, how has the incorporation of StemWave impacted like your business overall in terms of like your brand, have you noticed an increase in patient volume, revenue, profitability, or any of those sort of things?
Yeah, no, I think in my case with this place, it does add even more gravitas or credibility to the brand because we're able to so effectively deal with injuries or issues that maybe people have treated for a while and never been able to figure it out or see any relief, maybe with conventional Western medicine in some cases. But yeah, it definitely adds credibility, gravitas to any brand, I think. And then the StemWave, yeah, it's terrific ROI wise because basically if you do just I don't know, it depends on if you're paying for it up front or over time, but you do a patient or two a month. I mean, I think you're going to do pretty well with the StemWave, but you should do a lot more than that, of course. But yeah, no, it's especially at the price point it is compared to its competitor. Or it has been, at least when I bought it. But yeah, it's a great addition to any clinic.
Yeah. I
Yeah,
remember when we first spoke, that was also one of the main reasons you went with us because of price point, affordability, something that you as a business owner definitely have to consider, right, before going forward with something like this. So
sure.
I remember that was definitely one of the first things you had mentioned.
Yeah, especially if for what I don't know if things have changed, but
It's the same stuff.
yeah, the results are pretty similar. Yeah, you see the people get great results with StemWave or its competitors, and yeah, if you can get it at a better price, it makes all the more sense.
Yeah. And
Yeah,
it's here and we haven't changed that, right? So
right.
for I know a lot
You
of
really
people,
get in the weeds with the different
yeah.
mechanisms but yeah, when it gets down to it, it's just the results. Yeah,
Yeah.
yeah,
And then also cost being another a big decision maker, right? Key factor. So and it's been a year and we haven't changed that, right? And we're able to keep it at that price point. Um, Considering just like I want to hear from you at least like where do you see the future of shockwave therapy integration in athletic training and rehabilitation practices? Like, do you think there are any gaps currently? Are there potential advancements or areas of growth that can be considered?
well, I would think so. I mean, I think you hear different things about the way shockwave being utilized different parts of the world, but so I don't know if that'll become more of a customary practice here. Like here, I know StemWave's out of Turkey.
Yeah,
But
our
yeah,
manufacturer. Yeah,
so I've heard that it's been used for a number of different uses we don't use it for here. So it would seem that the StemWave shockwave devices can grow into these different possible applications and be even more effective. But you can say that about a number of modalities that exist or in the biohacking world now, that there's going to be potential for greater utilization, greater diversity with these different devices to treat all sorts of different things. But I think StemWave definitely has that potential. But I know there's research being done certainly all the time, and I'm sure new things will surface that it's effective for.
yeah.
Yeah.
Um, with that being said, how do you see your practice evolving with shockwave therapy? Like, what are some of your goals upcoming for 2024 since we are kind of ending the year right now?
Well, I don't know. I don't know. We'll just have to play it out and see. But I know it's going to be an integral part of what we're doing here. But I don't know if there's going to be other ways to use it or other ways that surface out there that where it's effective. But just for what I use it for here with injuries and joints, I mean, it's an integral part, like I've said. But yeah, hopefully different things develop. I wouldn't have any goals attached to it until those things surface. But
Yeah,
I'm hopeful. Yeah, there'll be more application and we'll find even more ways to effectively utilize it. That'd be great.
yeah. And more
Yeah,
importantly, just kind of keep doing what you're doing because it's
yeah,
fostering those results, right? So you've basically figured out some of those questions already. Now you just gotta continue what you're doing and take this further down. So
yeah,
um,
exactly.
that's awesome. Um, I like to ask almost everyone I work with. We have a lot of people who watch this, providers who, well, providers to be who are on the fence, to be honest, about going forward with the commitment. If you don't mind, like, what advice would you give to other practices considering the integration of StemWave, but might just be on the fence, perhaps due to many factors such as how they're going to pay it off, how they're going to market this, etc. Like, what would you say to them as like a boost of confidence?
Yeah. Well, I would just say from my own perspective, I mean, I haven't done any marketing, zero marketing at any level since I've been here for the STEM wave or anything else. But in the STEM wave in particular, the word of mouth is plenty of marketing. People that get better, they get issues resolved that they've had for years. They're going to tell their friends and other compatriots, and they'll come in. Everyone's looking for healing. Or around here, people play a lot of pickleball, some tennis, but I have a lot of athletes too that have boxing and skateboarding, and yeah, you get in those different communities and have some success, and then things sort of snowball. But maybe the marketing would make it even things grow even faster from the beginning. But that's not something I've done. But you can look at me as someone who's done no marketing, and the StemWave's been very successful just with word of mouth, just with the results.
Yeah, I
Yeah.
think I think that's huge because you can't really do that with other modalities. You can't do that as well, like with just services in general, right? So I think you saying that is a huge statement and it's a huge testament to your success, but also I do think it'll inspire a lot of other facilities or practices like yours to kind of make that step and to provide this sort of care and making it available to athletes and just overall in rehabilitation, right? So thank you so much for mentioning that. And then lastly, how can someone book an appointment with you and your team? How can they get in touch? What's the best way for them to reach out?
Oh, they can go, it's fitnessgenome.net is the website. You go there and book something. You can call 858-367-0210 or just drop by. We're in Carlsbad, California. Any of those options will do. But yeah, if you get a chance, especially if have an injury, come on by.
Perfect. And are you going to be treating them or are you going to have someone else?
Usually it's me. So usually I'm marshaling the whole intake process. So yeah, I'll take care of them if they come in.
He said it himself. He's going to take care of them.
Yeah.
Thank you so much. Thank you so much for sharing that.
Thank you, Michelle. Yeah.
And thank you so much for sharing your journey and your expertise. And I'm really, really, really happy that you guys are doing well. And you're going to inspire a lot of practices like yours to do the
Thank
same.
you. Yeah,
Awesome.
appreciate it, Michelle. Thank you.
Thank you.
Appreciate what you guys do for us too. Thanks a lot.